Welcome back to New York Links. The Caribbean American Outreach Association's medical mission's first stop was in Jeffery Town, St. Mary. Take a look. Hello, New York City. This is Keisha Allen with Zinc TV, and we're coming to you today from Jeffery Town, St. Mary. This is the first location of the Caribbean American Outreach Association, which is a nonprofit organization based in Brooklyn, New York. This organization was founded in 1998 to provide support and treatment to people who are living with the HIV and AIDS virus in the Caribbean as well as the United States. The doctors and the nurses from New York, they're setting up to provide treatment today, and we're going to go check them out and see what kind of treatment they're providing. We're here at the Seventh-day Baptist Church. Our medical team arrived this morning at about 10 a.m. The announcement was made on the local radio station, and the people are pouring in slowly but surely. This poverty-stricken community was desperately in need of the free medication that the CAOA had to provide. We spoke with Jean Hamilton, president of the organization, who highlighted the mission and purpose of such an organization. We're here with Miss Jean Hamilton, and she is the president of the Caribbean American Outreach Association. Can you tell us a little bit about this organization?
Well, this organization was formed in 1998 to cater for children with HIV. And so far we're taking on other issues, health issues with adults and children also. We go to the Caribbean islands. We also do health here in New York State.
What are some of the other Caribbean islands that you've gone to?
We've been to Trinidad. We have plans to go to Dominica and St. Lucia.
Okay, I know you said that you guys you see people with HIV/AIDS. What are some of the other illnesses that you guys treated?
Hypertension, diabetes, also of the foot, whatever it is, we try to do our best.
So is there somewhat of a system as to, I know when the people come in and they get medicine, it lasts for a certain period of time. Is there some kind of follow-up program in terms of keeping up with what they're provided here?
Well, we ask them to go see their doctor and give them a prescription to take to them if the medication runs out.
Dr. Errol Mallet, a board-certified urologist, explained why he decided to lend his support and time to this organization. He also spoke about the common illnesses he encounters in people from these communities. What made you decide to lend your time and your support to this organization?
Well, my philosophy is that you give because you got. And I've been very fortunate to have gotten. I just think it's a natural thing to give back, and I've been involved in medical missions for the past 8-10 years as a way of showing appreciation for what I've gotten, and that's just my philosophy, that you should give back because you've gotten.
You mentioned that a lot of the patients coming in today have problems with high blood pressure. What would you say is one of the reason or the cause for that in the patients that you've seen thus far?
Well, in addition to probably hereditary and genetic reasons for high blood pressure in the African American, Afro-Caribbean population, I think dietary reasons probably contributes largely to high blood pressure.
I'm here with Miss Noilette McKenzie, and she is a nurse here from New York. And can you tell us what has it been like today thus far?
Well, at the moment, it's not that busy as yet. I'm just now triaging the patient, after which they will see the doctor. And that's basically it for today. Do their vital signs, get their chief complaint.
It's been 3 hours since we've been here, and so far we've seen about 34 people, approximately 34 people. So, and there's still some more, as you can see, left to be seen. So it is shaping up to be a pretty successful day. Zinc TV also spoke to some of the patients from this Jeffery Town community to get their views on how they felt about being able to receive these services. So what do you think about this event?
Well, it's very useful, because some of the time to go to the doctor, some of the time it is very expensive, the transport and what have you. But we are grateful, very grateful for this opportunity.
How did you find the treatment here today?
Good.
Were all your needs met?
Yes.
We are giving you this the basket. Been so good. You're my first patient this morning, and all the best. Hope that everything will be okay. All right, bye-bye.
Last year we saw several patients that we saw the year before, particularly with diabetic issues. In a couple of instances we had to send patients to the hospital because their blood pressures were so high, and we thought it was dangerously high, and we sent them to the hospital for more emergent care. And in 2 instances last year at least, we saw those patients again with much better stabilization of their blood pressure. So that was encouraging.
We're back after the break with more.